Can you hear any music at all?
No, and I also can't get my Word document as now, since you put the screen up, my Word document has disappeared.
Quiet. I'm live. Okay, I'm going to stop this share and go back because we're live right now. I'm not sure why it's not, the sound is not on. Let's do this again. I don't know why the sound is not on. Okay, I'm not getting the, I'm going to try this again. Mm-hmm. Well, hello and welcome. Namaste to each one of you, and a happy new year to all of you. Hope you guys are doing well, and thank you so much again for joining with me as I present my very first segment for 2021 on the Sunday afternoon Lime. Again, thank you so much to everybody who is logged into Facebook and YouTube right now. Thank you so much. It's good to be back on the Sunday afternoon Lime, and I'm so happy to have you all again. Supporting me and supporting my endeavors here on the Sunday afternoon Lime. And I just want to say thank you so much from the bottom of my heart for your continued support of me and everything that I've been doing so far. I trust that everyone had a great holiday, and it's been wonderful. Well, I shouldn't say wonderful because I didn't get to see my daughter during the holidays, but I'm pretty sure you've all had your families over and you've had some wonderful experiences, of togetherness and being together in your homes, celebrating the Christmas holidays and the New Year. So before we get started today, I just want to say, I just want to take a moment and ask each one of you if you could take a moment out of your time right now and share this page, like and share this page to all of your family and friends so that we can have as many people here on the platform today to listen to this panel discussion that we have on COVID-19. It's really important as our numbers are rising each and every day. I have a co-host with me today, and it's my privilege and honor to introduce Mrs. Urmila Singh. She is a supervisor of one of the largest police forces in Ontario, and she just happens to be my sister. So let's give a warm welcome to Urmila.
Thank you, Mala. And I must say, it's a privilege to be here on your show. First of all, I want to say hello and Happy New Year to your viewership. And just let me make a statement in advance, please. I'm not a professional like you. This is my first time co-hosting, and I do thank you for the opportunity. So any errors I make during this, during this live stream, please forgive me in advance. But once again, Mala, I do thank you from the bottom of my heart for giving me this opportunity. This is a subject that's very near and dear to my heart from a professional and a personal level. So I'm looking forward to being your co-host today.
Awesome. Thank you so much. And I'm pretty sure that you're going to enjoy every bit of it as well, too. So with that being said, I hope you guys can show her some love. Give her some love, everyone. This is my baby sister. And, it's her first time on the program with me here today. And I'm super excited to have her on. Well, 2020 definitely did a number on the world, and the drama continues. So I thought, as this is the first segment of the new year, why not start it off right with an update on what's happening around the world with this dreadful virus called COVID-19. What is your take on this virus, Urmila? I'm pretty sure you have, you've been exposed to quite a bit being in the police services.
Well, what I can say is we all know this virus has paralyzed the planet over the last year now, and it really has shown no sign of disappearing. The rates of infections is rising on a daily basis at an alarming rate, and it's really crippled our world economy, and it's affecting millions of jobs and businesses across the globe. Currently, the world stats are staggering. I'm just going to give you some of the stats as of January 10th. In about 218 countries across the world, we have reported about 89.6 million COVID-19 cases and approximately 1.9 million deaths since China reported the first cases to the World Health Organization back in December 29. These numbers are absolutely staggering.
Well, they are indeed. And we all know that COVID-19 has caused major disruptions around the world for the past year and still going strong, with severe lockdowns and curfews happening worldwide, and with more severe travel restrictions in place. For instance, the province of Ontario currently is in lockdown right now. We are supposed to be in lockdown for 28 days. And this lockdown is supposed to end at the end of January, but our numbers are rising. Therefore, like for instance, as of Friday, January the 9th, we've had over 4,200 new cases. And if this trend continues, we're being told that more drastic measures will be put in place, and with an extended lockdown and possible curfew.
And Mala, we also know that there are now two different strains of this virus stemming from the UK and Africa, and it has spread into Australia, Canada, the USA, and various other countries.
Well, we also know that there are several vaccines available right now, and they've been administering them to frontline workers like the doctors and nurses and those on the front line. And in some countries, the elderly over the age of 65. So we will talk a little bit more about that in a bit. But at this point in time, I just want to say, I want to take this opportunity. I'm sure you will agree with me that we need to thank our frontline workers who risk their lives each and every day for us, to feed us, to provide the stores with food and medicine for us. So pretty much they're basically like our saviors. So to all healthcare frontline workers, I say thank you from the bottom of my heart, and from all of us. Thank you very much for all that you're doing for us.
Absolutely.
Yeah. And without further ado, I'd like to invite I've got a couple of guests are sitting here waiting, and I'd like to invite them in right now. So let's do that. And then we will, okay, here we go. Okay. Here we go. All right, we have one of our guests, and where are the other two? That's to unmute. Okay. All right, so we have two doctors, one from the UK and one from the USA, and we also have Sunanda, who is also from right here in Canada, Toronto, I believe. So let's just wait a couple more minutes and give Dr. Bhasin, and not sure why they're not able to. Yeah. Can't see them.
All part and parcel of doing things in a different way now and with COVID-19. So I'm sure the viewers.
There we are.
Okay, sorry about that.
Can you turn your camera the other side, please?
What about now?
Okay, perfect. Thank you.
Welcome.
All right, so we'll proceed with the formal introduction. Is Dr. Bhasin going to be joining us?
She's online with us, actually. You don't see her?
It looks like a connection issue.
Let's see. We've been texting back and forth.
Yeah, she was on for a bit there, and then she disappeared. So.
Okay, let me text her.
Okay, perfect. Okay.
And meanwhile, I'd just like to say thank you, Mala. and Urmila for having me back again. It's been the third show. And I want to
Yes,
commend you guys for, putting so much time and energy and effort into keeping our people educated and, paying attention to removing all of the myths and putting the facts out there. And I want to say thank you very much for, advocating for education. Thank you
yes.
again.
You're very welcome. Dr. Chandran, are you still there? Did you get hold of her?
Yes, but Mala,
Okay.
can you let Dr. Bhasin in? She's saying.
Um, I did, and now she's disappeared again.
Okay.
So,
I'm sorry. I'm just was trying my computer audio, but
yeah. Okay, so I'll just wait for her to come on, but in the meantime, I'll just get started with our introduction of Dr. Vijay Chandran. He is a psychiatrist based in New York, USA. He's also a physician with significant knowledge and direct patient care experience in medical, surgical, ER, ICU, pediatric, psychiatric, orthopedic, and OBGYN unit. He also has research interests in mental health technology, substance use, and public psychiatry. He's also a registered nurse, a certified case manager, and he holds an MBA in healthcare management. He is also the CIR Psychiatric Department representative in the Bronx, and many, many more numerous accolades to his name. And in his spare time, he still has time to play soccer, cricket, and volleyball. I am very impressed. Thank you so much. Welcome again, Dr. Chandran. It's good to have you with us again.
Thank you, Mala and the team. I do recognize some faces. I mean, it's just been a great excitement to be back here again. We never thought this will happen, but here we are. So hello to you all.
True.
And hello to my friend from UK, Dr. Chavi Bhasin. I see her right now. Can you see me? Can you see all us, Dr. Bhasin? Yes, okay. She's on mute. Great.
I've just...
Yeah, sorry about. Thank you, Dr. Chandra. Thank you. Nice to meet you all. I hope you can hear me all now.
Yes.
Awesome.
And actually, I'm going to jump in. It is actually my pleasure to introduce Dr. Chavi Bhasin to the panel. She currently is living and studying in the UK, but is originally from India. She is currently practicing adult psychiatry in Norfolk, England, and she was working until 2018 as a consulting psychiatrist in India, where she had her own practice in Delhi. She believes in 3 areas of mental health, and that lies in holistic healing, nutrition, and ecotherapy. She has finished a 2-year GMC fellowship in adult psychiatry in England, where she was awarded the MD student while pursuing her specialization in psychiatry. She is trained at the prestigious Malhulana, and I do apologize if I say that incorrectly, Malhulana Azad Medical College in Delhi, India, and her interest lies in borderline personality disorder. Welcome to the Sunday Afternoon Live, and good to have you with us today.
Thank you so very much. Thank you.
And also, I do want to introduce the next guest we have on the panel. It's Mrs. Sunanda Dhanna. Again, Sunanda, welcome to our program. You've been here before. Sunanda is a registered nurse at Trillium Health Partners, specializing in neurosurgical nursing care, and also works at the Assistance Service Group, providing telemedicine services for the Ministry of Health in Ontario. As a telemedicine nurse, she's worked with a broad cross-section of our population with all age groups, focusing on providing education, symptom assessment, and management for a variety of health-related concerns.
Awesome. Thank you, Sunanda. Thank you, Dr. Bhasin.
Thank you guys again for having me. It's a pleasure to be here.
Awesome. Thank you. We also have a written statement from a certified RN who works out of the Johns Hopkins All Children's Hospital in St. Petersburg, Florida, and she is Aruna Jagdeo. She was on one of our panels back in July, I believe, and she couldn't be here today, but she very generously offered to give a statement, which I'll read in a little bit. And we also have Mrs. Asha Rambaran Seward from South Africa. Asha is 49 years old. She's South African. She's a South African Indian, and she's got some underlying health issues. She's a diabetic with high blood pressure. She has been tested positive for COVID-19 and has been in isolation for the past 10 days. So she wasn't well enough to come on live with us today, as it's really late right now in South Africa, 7-hour time difference. And so she's offered to send us in a video sharing her experiences with this virus so that our audience can have a better understanding from, you know, somebody, some common person just like us, you know, because sometimes we hear about the news, we hear about people dying, we hear about people getting sick, but until it resonates with one of us, we don't really, I find that people are not taking it seriously, right?
Absolutely.
So I just want to say a big, big thank you to all of you, and I really appreciate you all taking time out of your busy, busy schedules to talk about this COVID-19. It's really, really important that our guests and our audience members take heed of what our panel is going to be talking about today, and sharing your opinions as well to the public. So we've had this conversation back in May. We've had this conversation in July of 2020. We talked about this second wave of the virus and how deadly it will be. So here we are, right smack in the middle of it again. And you know, the daily numbers are rising worldwide, not just here in Ontario or in the USA or UK, but worldwide. We're in the middle of a second wave of the pandemic. So what I would like at this point is if all of you can take a moment and share your experiences of what's happening in your respective countries and hospitals that you work out of, from say the inception of the virus from say March of last year to current, and where we're at right now. What are you guys seeing? What are you hearing? What's different since the last time we spoke? So why don't we, seeing that Dr. Bhasin is a newbie on the program, why don't we start with her, and then Dr. Chandran, we can go to you next, and then we'll go to Sunanda after.
Okay.
Thank you, Mala. Can you hear me fine?
I can hear you perfectly clear.
Thank you. Well, I totally agree with you. Just when we were about to think that this virus is going away and we might be back to the normal world, it seems like it's making a comeback, so to speak, and it's really unfortunate. So here in England, actually, the cases are really going up. This particular strain that we are dealing with in UK seems to have far more transmissibility. So even though we were hearing that the fatality rates are not as high, it's not as fatal as the previous strains were, but the transmissibility rates were far higher. So even with people maintaining social distancing and wearing masks, it was evident that it was spreading at far higher rates, which has unfortunately led to the number of cases rising. And we're really struggling here in this country actually with the resources. At the same time, though, the positive news is that the vaccine has now been there, and the process of vaccination has begun. So hoping that the herd immunity is slowly going to go up. What the health experts are speculating is that perhaps by Easter, we should slowly be getting back to the normal world, so to speak.
Okay, thank you, Dr. Chandran.
Yes, so just to reinforce what Dr. Bhasin just shared, that, cases are still rising, and what Mala mentioned, that it is a reality, and it is a reality. I just like to share some numbers to give a perspective. So, because numbers mean a lot in this case, especially. So worldwide, the total number of cases is like 90 million, right? and the total number of deaths close to 2 million. And out of the 90 million, only 50 million recovered. This is worldwide. As far as US, it's almost 1/3 of the total worldwide cases, close to 22 million, and less than 500,000 actually died. Now, New York is in par with the trend. So currently we stand at 1.12 million and almost 40,000 deaths. And well, unfortunately, in New York City where I live, the total number of cases is almost 500,000, and the deaths close to 25,000. So the reason I'm sharing this is I looked at, like, when we were talking May, June and all that, the trend has been reflective of what is happening in the environment, right? We have holidays, celebrations coming in, and the cases spike. Then we had the new strain that contributed, protests here in New York and elsewhere in the US. So yes, you have the coronavirus. If you were to leave it alone, it would probably, affect us less. But we live in this world where, the geopolitical situation, which kind of exacerbates, the corona spread and whatnot. As far as here in New York, although the case has been rising, especially like in the last 1 or 2 months, not with the strain, because we didn't get the strain. We only discovered the strain here in New York more recently. But again, because of, it's a melting pot. Traveling has really never stopped. It was released. So we continue to see the number of cases. But I have noticed one thing: people are more complacent. They're taking it like, okay, it's there. People are still partying. People are just, gotten desensitized. So yeah, so going back to the strain, this is a fear for us, especially although the scientific community believes that the vaccine is both the Pfizer and the Moderna, and for the AstraZeneca for that matter, is effective against the new strain, but still there are a lot of unknowns, right? We all know. I mean, my knowledge is as much as yours, which is the news and the literature. But one thing I do know is that we still don't know much about the virus itself, the new strain itself, and also the so-called personal natural immunity. Before they used to say, okay, you can, let's say you get corona, you could be immune, but even that factor we don't know. So so just wanted to kind of stress that we still don't know much about this whole thing.
Okay, we'll come back to the strains, the different strains on the vaccines, but let's hear what Sunanda have to say.
Well, Mala, since the last time we spoke, we were anticipating a second wave at that point in time. And again, I agree with you. We're in the middle of it. And as we see here in Canada, in Ontario specifically, because that's one of the hotspots, the provinces that's been identified as a hotspot, every single day we're breaking records. So that in itself speaks for itself in terms of what or the current situation is. And, it is pushing us to really think about various things that we need to put in place. For example, I know that we might be considering having a curfew put in place, like the one that's in Quebec right now, and that's been used in Australia, which I believe, it is sort of extreme, especially given the liberties that we enjoy in Canada. So that in itself speaks for itself. The second thing that I've noticed as well, the hospitals had a chance to prepare from the first experience, but even with all that preparation, I find that we're still struggling to find ICU beds. I mean, there's many shifts that I've worked where we're wondering where we're going to put patients, because we have an influx of so many people coming in, all age groups, all backgrounds with the virus. So search planning is in place, but we're still experiencing challenges finding resources to accommodate people who are sick. And thirdly, one major thing that we need to focus on, or we are focusing on right now during the second wave, is obviously the vaccination. Even though we've procured the vaccination. We have promises of vaccines to be delivered to Canada. There's still a lot of debate and a lot of struggle as to how to figure out how we're going to distribute the vaccination. How can we distribute the vaccination quickly enough, even though we have the vaccination on hand. Sometimes it's just the logistics of how to get it there. And I think that a lot of us have seen stories where there's a supply, but not enough resources to deliver it. So I think that here in Canada, we're still as well learning as every day goes by how we're going to battle this COVID-19 fast enough so that we can control the factors such as the variant, because obviously we're in it, we're racing against time. So I believe since the last time we spoke, those are the major things that we're focusing on here in Canada right now.
Well, thank you very much for that. We will come back to some of those things that you've mentioned here. But before we do that, I want to read Aruna Jagdev's statement from Florida, and then we can open up the discussion further into vaccines and the different strains and what we're doing right now. So Aruna says, the situation in Florida is serious, much like other states. We continue to climb in positive cases and deaths. Part of our issue is the lack of regulations from our state and local leadership to lock down and mandate masks. I also strongly feel that other than people going through a period of, people are actually going through a period of COVID fatigue from isolation and lack of social contact. The holidays didn't help. It only hurt this as we saw people continuing to have gatherings over the holidays and spikes in numbers after. Vaccines are now being given out to hospital staff. I received mine today with no issues. Some adult hospitals and health department locations are also vaccinating the elderly over the age of 65, but it seems a bit disorganized. Florida was a bit late with getting vaccines compared to other states, but we are working quickly to get clinical staff done so that we can help with doing the rest of the public safely. Reminder to everyone, masks are needed. Mask needs to be worn even after the vaccine. It takes 8 to 10 weeks to begin to show immunity, and we just don't know how long it will last. We need people to be vigilant and keep trying to be safe until we can get the majority of people vaccinated to get to herd immunity. The good news is that there are 2 more additional vaccines on the horizon this month, and I'm hopeful that we will beat this. So it seems that each state, each country, I mean, we all have the same problem, and we're all dealing with it differently. And we have people are just not adhering to the rules of wearing a mask. She is right in what she says, because I just saw a video a couple weeks ago during the Christmas holidays from Florida, from one of the beaches there, and nobody had masks on. Everyone's just like crowded on this beach, and they're having a hell of a time. And you know, what's happening? Do you feel like people are just fed up at this point?
I just think, Mala, yes, I do agree with you that there's some sort of a fatigue and boredom setting in people, and perhaps everybody is just waiting to get out and be out there and do things. But we also cannot forget the fact, and that's something that I have observed as a psychiatrist for last 1 year, that aside from the COVID peak, we're also kind of in the middle of dealing with a lot of mental health problems as well, because what we cannot really underestimate the impact of is that the whole isolation and not being able to socialize as much as we were able to do in pre-COVID times is certainly leading to mounting anxieties in people who are struggling with generalized anxiety disorder. That has gone up. People who are struggling with hypochondriasis, that those kind of anxieties have gone up. In the absence of socialization, the relapse of depression rates is quite there. So while I do understand that this is going to have negative ramifications as far as COVID spread is concerned, but we also cannot sort of ignore the fact that the whole process of socialization and the whole scenario in the world where we are not being able to get out as much as we used to is certainly taking a toll on the mental health of really all of us. So I'm not suggesting that we shouldn't be isolating ourselves. I think we more than need that right now than ever, really. But perhaps, especially in countries, in developing countries where there isn't enough support for people who are struggling with mental health problems, it can be an even more difficult situation. Even domestic abuse has gone up. So it's really difficult. It's really difficult to sort of strike a balance, and perhaps that is what is leading to people getting out so much when we don't expect them to.
Okay. So Dr. Chandran, in New York, what is it you're seeing on the streets?
Wow, New York street was always busy, regardless of what's happening. But now more so now that we had multiple holiday sessions, people just couldn't hold themselves. Besides adding to what Dr. Bhasin said, one of the things that has increased, like I would say, I think it should be okay to generalize, is the increased use of illicit substances, not just limited to alcohol, drugs and marijuana and cigarette smoking. So the New York culture is, the way New York is set up is, as you know, it's more vertical, right? Social gathering it's a key part of the social life here in New York. So there are parks everywhere, there are parties everywhere. We are outdoor people as much as we are indoor for recreational things. I would say, like, up until June, July, people were like, okay, we're going to wear masks, we will limit ourselves. But once, like, we got into August, September, like, then, summer is going away. People are like looking forward to Christmas. The heat is on. Like, we start celebrating 1-2 months before the holidays. So people don't care. Though we used to have like news all over the place of people dying, increased cases, potential new strain, vaccines still not going to the public until mid of next year. People, I guess, like you're all thinking and saying, the fatigue and social isolation. One thing I have to say, just to remind you all, I don't know how, like New York was the first, like I would say New York City was the first to get hit hard, right? But then we were the first ones to actually, for the cases to go down. We did pretty well. And I would say, like, even when we compare now, besides the dense population, we are not doing bad. Like before, I used to get, like, in March, April, my hospital, I would get alerts. Okay, like almost daily stats of the number of cases, the number of deaths. There was like a high level of alert. Now we don't get much email alerts as such. So overall, I would say we are doing okay. Yeah.
So currently we have America, Brazil, India, and the UK with some of the largest amount of infected people with the COVID-19 virus. What, in your opinion, do you think world leaders can do better to flatten this curve?
Well, before any of you answer that, I have a short video that I want to share, and it shows the stats by the number of deaths per country. The video has no sound on it, but as you can see, you will see that it's really staggering if you take a look at this. So pretty much this is a chart that just shows the number of deaths by country right now. This is February. You got China and the Philippines only, just 2 countries. And you will see how it's increased over time. And this is just really, really staggering. I'm going to fast forward a little bit so that, our viewers don't get too bored with this. So this is March, April, May.
Wow.
June, July, August, September, October, November, December, this is amazing.
This is just,
These are the numbers from the USA alone.
okay.
So the UK seems to have a lot more of this, like new cases. Dr. Chavin, sorry, Dr. Chavi, sorry about that. Let's ask you on mute.
Yes. That's,
So,
yeah, go on.
So, what are some of the situations that the government is like? What is the government doing there in your country right now to flatten the curve?
So one of the things, Mala, that we have gone back to is we are in the middle of third national lockdown right now since last days, and this is here to stay for good 6 weeks, and some people are in fact speculating that this might get stretched until March end. And I think this was a very pragmatic and wise decision on the part of the leaders here, because we certainly needed to ensure that there was social distancing, and that really cannot happen in the absence of a national lockdown. So that's one of the things that's happening here in UK. The other thing, of course, is that vaccines are now there. As a matter of fact, I received my first dose of vaccine today. So things have gotten intensified. People are really working hard. Everybody is volunteering to administer those vaccines. So the frontline workers and the vulnerable people are now already getting their vaccines, which of course is going to go a long way in helping us flattening the curve. Aside from that, well, schools and colleges, they have gone back to now online platforms. None of the physical teaching and colleges that was resumed has thankfully gone back to being made available on online platforms, which is definitely going to go a long way. Having said that, though, London right now, as we speak, is in a very difficult situation actually, and they're speculating that we might be running out of beds. Doctors and paramedical staff, they're overstretched. Um, but hopefully this national lockdown, hopefully vaccination, and hopefully the fact that where there was a lot of mingling taking place, like schools and colleges, that not taking place will help us in flattening the curve for sure. But yeah, for the most part, we are hoping that the lockdown is going to help us a lot, which very well might be getting stretched even until March end.
So what is the case with this second strain that's coming from the UK? It's made its way like pretty much around the world already. What is the government doing about that? And is there a vaccine for that?
Well, the reports which have come in thus far, Mala, they say that the existing vaccines which are there, like Dr. Chandra mentioned as well, are very well effective against this current strain as well. As far as the properties of the current strain are concerned, it essentially gives the virus more transmissibility. So essentially, it sustains itself longer on surfaces, and it has higher transmissibility. So what I'm really trying to say is that even if people were to maintain the social distancing that they were doing earlier, even then the virus has a higher chances of getting spread from one person to another. So even though thankfully the fatality rates are not as high, which basically means that the chances of death after acquiring the infection are not as high as compared to the previous virus strain, but the transmissibility is so much higher that when we were having a certain number of people getting infected earlier, those number of people have gone up tremendously. And we can imagine that if the number of people getting infected is going to go up, then by that logic, the death rates are going to automatically go up. So, unfortunately, 2 days back, England has seen death rates going above 1,000 people a day, and that's
Mhm.
yes, that's yes. So, despite the fact that the fatality is not high, and it's difficult to contain a virus which has got this kind of a transmissibility, because apparently it is staying on surfaces for far longer time. Apparently, even with the masks and even with staying 2 feet apart, the virus still gets transmitted. So, which is why,
Mhm.
yeah.
Wow, that's incredible. Sunanda, what are you hearing here in Ontario?
So I'd like to add to what Dr. Chavi was saying about the COVID variant, and to make it, I guess, to put it into a simple illustration. So if when we do the swabs, usually we take like a nasal swab. Sometimes we take a saliva sample as well. So just to put a picture of why this UK variant is more transmissible. So whenever you take a swab, you get like a viral load. So you get like a certain number of the virus present in the sample. But with this particular variant, you have double the number of the virus present in the sample. So that makes it even more transmissible because there's a higher viral load in the samples. The good news is that as far as my research also corroborates what the doctor also said, the current vaccine, it shows that it is it is effective against the virus, and so that is promising. But we still have to continue being very vigilant and very careful about our social distancing, etc. At this point, so we can keep the virus well contained.
One of the interesting things, Mala, if I may add, that has been observed about this current strain is that, interestingly, hand washing has been found to be very, very effective. So, up until now, we have been focusing so much on disinfecting and so much on sanitizers. But what has come to light is that with this particular mutant strain, hand washing, rigorous hand washing, of course, surgical hand washing goes a long way in reducing the transmissibility, even more than the masks. That is not to say that masks shouldn't be.
Absolutely.
Yeah.
Mm-hmm. Mm-hmm. Okay. So back in March, we were told that the virus only affected the elderly, and now that is not so, because we've seen a wide range in age groups, who are
That's right.
hospitalized.
Yes.
So why has the demographics changed over the past months? And can you give us an idea of, how many children are being infected in your respective countries?
So I guess I'd like to start with that because it's interesting. Again, we spoke about this. I recall in on the last show we talked about
Yes.
the a particular demographic that this virus is really high in, and that's the age group of 20 to 29. Fortunately for that demographic, it's shown that the recovery rate is really high, which is good. But the bad part of that is that those within that age group can transmit to people who are more susceptible and more vulnerable, such as their grandparents and other family members or friends or whatever the case may be, who are maybe immunocompromised, and they're the ones, unfortunately, who will suffer the most. Um, so again, it could be a variety of reasons. As we all know, at that age group, we're more sociable. We depend on peers. We like to socialize. So it could be, again, a lot to do with risk-taking behaviors. And I don't want to label or stereotype that age group at all. I respect and believe that they've got a valuable part to play. But it very well could be because they tend to be a little bit more daring and non-compliant to some extent with whatever, I guess, constraints have been placed on us at this time.
Yeah.
And I think one thing we have to keep in mind out there in the public is, the government and healthcare workers, we're not here to say we're stopping your civil liberties, because I've been seeing in the news multiple protests going on about how people's civil liberties are being taken away. This is not about that. We're in unprecedented times, and in order to flatten the curve, there are certain restrictions that has to be placed in order for people to ensure that this virus isn't spread. So I think one of the good things about programs like this is to educate people, to make them understand what are the risks, and what are the things that you can do to ensure that you're not compromising others, because you may be healthy, you may have a high recovery rate, but again, like Sunanda said, you may spread that to someone that doesn't have, the recovery rate that you do. And I can personally talk about an incident that just happened within our family in Texas, our extended family. We had a son, a mother, and a father. The son went out and was exposed to the virus and brought it home unknowingly, wasn't aware that he had it, brought it home and unknowingly spread it to his mother and father. Fortunate for him, his father recuperated from it, but unfortunate that as it was passed on to his mother, who had underlying medical conditions, she passed away, and so did he several days ago. So it's really important for people to understand this is not about curtailing your civil liberties, but it's awareness and being able to be responsible to not ourselves, but to our communities.
Right. We
Yeah.
find that
You know,
more often now than ever. Like, there are so many young people, and this is the message really that I wanted to drive home to a lot of our younger generation out there, that we know that you're tired, we know that I'm fed up of being at home, and so are all of you. I'm so tired of just not being able to go out and go to the mall and go to the movies, and so right now we can't even leave the home. We can't even drive in our car and go to a different city because that city is on lockdown. And if the cops stop you at any point and run your license plate, you're gonna get a ticket for being in a different city.
Yeah, and
Mala,
this.
I'd like to. Sorry about that. Go ahead.
No, go ahead after you, please.
I was just going to thank you so much, VJ. I was just going to add to the discussion here about family members, and I'm pretty sure Dr. Chavi and VJ might also have witnessed this in their practice. There's many heartbreaking, heart-wrenching situations that we witness every day, where we see families being separated. If their loved ones get sick, families are not allowed the same liberties to come and visit. And it's really hard to see some patients who are really ill, on the verge of God knows what, maybe even passing, and being unable to have their family members present at their sides. And that's where healthcare workers come in. Like, we have to become their family, we have to hold their hand, we have to be the ones to hug them and to comfort them. And sometimes, Mala, or Mala, I pride myself on being a pretty strong nurse. I'm very resilient, but sometimes it does get into your psyche. It bothers me as a mother, as a daughter, as someone's loved one, to know that at the end of life, after spending your entire life with someone that you love, at that moment when you'd like to be with them, to say goodbye, that privilege has been taken away from you. And I can't begin to describe how devastating that experience is for so many people that we see on a daily basis coming through our healthcare system.
Yeah. Oh my goodness.
Yeah. So Mala, I just wanted
Yeah.
to, sorry, because I think we were talking about flattening the curve. So just a couple of comments on that. Yes, we are all like so far aware of the UK so-called super strain. And here in the US, we found this UK strain in 6 states, including New York, right?
Yeah.
However, there is also scientific literature. There is a much more stronger, more infectious, like Dr. Bhasin was saying, they're not necessarily fatal, but they're more contagious, more infectious. They create more cases. Of course, with more cases, more deaths come. So there is a new super strain from South Africa. So I don't know if y'all came across this in the literature. And in fact, there is a doctor in London who's actually Dr. Adam Kruski. He is from the London School of Medicine. London School of Hygiene. I'm just quoting his comments on this particular strain. Dr. Adam Kucharski, London School of Hygiene and Tropical Medicine, and he specializes in math of infectious diseases outbreaks. And he says, according to his math, the infectious strain will be more deadly. Okay.
Wow.
And this is a more recent article. But the point is this. So yes, we have the vaccine. We are taking measures. For example, New York has taken is going back. We are closing restaurants. 10 o'clock is the curfew time. They need to shut down. Fine. But then the challenge with the strain will remain. Just like the influenza virus, which mutates, which changes itself every year. You need a new vaccine every year. That's the nature of the virus. We are trying to fight the virus, and the virus itself is trying to survive, right? So it's a natural process, but it's not going to be easy overcoming just with a vaccine. We have to face it. This is going to be a problem for the next 1-2 years. It's not going to go away. It's going to go away slowly. Okay. So it will be part of our life, just like the AIDS virus, just like the influenza virus. So I just wanted to kind of make aware of us and the audience is watching today that, yes, we have the UK strain, but also the South African strain that is out there.
Okay.
Armala, you did ask a very important question earlier. You asked about world leaders. What can world leaders do to help with this? And that is such a key question because that's where it all happens. That's where the policies are made and everything else is executed. So my take or my thoughts on that is, number one, world leaders have to work together somehow. And Canada has always been at the forefront of ensuring equity and accessibility in a variety of matters, and of course this one, ensuring that vaccines are available, not only to Canadians but to countries that are poor and not able to maybe to afford getting enough vaccinations for their population. And what I wanted to raise here is that Canada is actually a part of the COVAX. I'm not sure if the UK and the US have enlisted in this, but what the COVAX facility is, it's a kind of global mechanism where countries work together. They pour in resources and ideas, etc., to ensure that there is a safe delivery of the vaccine, there is equitable delivery of the vaccine, and it's accessible to everyone. And I believe that this is key because if we control the virus here, it's still not going to be, under control if we have our borders open and we have people coming in from different countries that still have this as an issue. So for me, the number one thing is having our leaders work together to tackle this on a global level. And I believe that this is one key factor that will help us to control and contain this virus.
I think also, Sunanda, just recently, people were coming from abroad and they were coming in from overseas, wherever, and the airport was not conducting any type of testing or anything, or even asking for any, if they're, asymptomatic for one, or if they've they have a fever or anything like that, or did they get a test result from the country that they were in? So I think that's how we ended up with the second strain from the UK.
Actually, Paula, we did have like some policies and so on in place for international travelers, where it was required that they have a negative COVID screen at least 3 days before they were able to travel. And when they enter into our ports, they had to check in and say, "Hey, I'm here. I'm gonna go home and quarantine." And then you had the Canada Border Services following up to ensure that people were doing their mandatory quarantine. However, the process was in place, but somehow it got messy because there was too much
Exactly.
happening and there was lots of holes and so on in the policies. So I believe that they've recognized that as a problem and they are actively trying to fix it. In fact, as all Canadians are well aware, and especially in Ontario, they've recently set up the voluntary COVID screening. When you come into the airport, you're asked whether you want to have the screening done. However, the other piece with having the negative COVID screen, it is still in place. And when you come into the airport, if you are symptomatic, you do have to continue with the mandatory vaccine, the isolation, as well as having a test done. So we do have policies and procedures in place.
So I
It's
think,
just the follow
yeah,
through that's the problem.
the reason why I say that is because I was reading an article from WestJet the other day saying that they've had to, based on the recent developments in Canada and our policy, they've had to turn back some passengers trying to board to come home because they didn't get a test. They're supposed to get a test in whatever country they're in 72 hours before traveling, and they didn't have that, so they weren't allowed to board, which is a good thing, I think. So, but I
I mean, I
mean,
do agree with you. We
there's a
should be
cost.
avoiding
Mhm.
non-essential travel. We've been asked to do that from the beginning, and I mean, right here in Canada, you've seen top officials still traveling, and it's something that we've heard from day one. Non-essential travel should be avoided as hard as it is, because I know lots of people are separated from their loved ones. But again, we have to look at the bigger picture here. We're fighting against something that's bigger than any one of us, and we have to work collectively to be able to beat this.
Yes, absolutely. Dr. Chandran, do you want to add anything to that? And Dr. Chabi?
Just a comment on the news train, right? Because yes, Mala, just to as far as I can learn from what I'm reading and my personal opinion, the current test for which is we use the PCR test to detect the actual strain. It wasn't, even though we were testing, it wasn't designed to pick up the strain itself. So that's correct me if I'm wrong, Dr. Bhasin, because it doesn't pick up the new strain. So we even if we had measures, especially international travel, so it was still flowing into different countries. So that is one thing. And the second thing is, as far as going back to flattening, I know we're going to talk about the vaccines. I think you will bring it up as the third topic for us. But but for me, I feel, and I do have another thing about besides the vaccination. I mentioned this last time too, but I don't want to break it right now. But basically about personal immunity, I think the most definitive mandate, like legislatively, I think even globally, is to mandate vaccination, because this is not, COVID might be new for us, right? But disease is not new for us. Viruses are not new to the human scientific knowledge. We have done this over and over again. We are experts in this.
So what do you say to people who don't want to be vaccinated?
Okay, first of all, if they give a scientific reason, I would buy that. Like Dr. Bhasin was saying, I took my vaccine about 2 weeks back, and in our hospital, a total of 300 healthcare providers were vaccinated, and the communication is very open and honest. The only reaction was local injection site pain, and some people had headache, fever. This was the most common complaint.
Okay.
No other fatal adverse events happened. So to answer your question, if somebody is refusing COVID vaccine, they may want to think about what is the scientific reason, or do you have a political reason, or do you feel there is so much theory, conspiracy theories about coronavirus you won't believe, right? I'm sure you probably came across that Bill Gates created this, and there is pharmaceutical companies behind this whole thing. And again, people who believe in these kinds of non-scientific theories to explain this pandemic are the ones who are refusing. Okay, they are in denial. So maybe they need to see a psychiatrist. I don't know, a psychologist for that matter.
Well, I know that I've spoken to quite a lot of people, and a lot of healthy people who have said that, okay, if I'm not sick, why do I need to take the vaccine?
Because again, like your friend who's, I actually probably shouldn't be talking about your friend who's in the hospital currently. Vaccines are given to prevent from getting you a disease. Okay, just because you don't have corona today, you may get a super strain of corona tomorrow, or you might get a different vaccine that we don't know.
Here's another question for you. Have we tested this vaccine enough on enough of the population to know that it will really work?
Okay, this is the thing, right? The studies did not occur in normal circumstances, which is you need a X number of sample size, and you need to study this post-launch. You actually study it post-launch, but we couldn't get to that stage because of the emergency, that we needed. So yes, it was studied less, but given that it was effective in 94%, 95% of the population, of course it has risks. Okay? But if you read the literature, there were no actual significant adverse events from giving it to the sample population. So in any treatment, right, there's always benefit versus risk. So what is the benefit significant enough compared to the risk? Then we have to use it, because that's the only hope we have.
Actually, this is a great segue into the next question that I have to our panel of experts is, can you give us a quick overview of the vaccines that are currently available and any other medications that are being used to treat patients with COVID-19?
Okay, so I guess I'll start with what we have here in Canada. So right now, there is 2 approved vaccines. I just wanted to go back a little bit and talk about why choose vaccines. So, I believe that vaccines are truly an achievement. It's a public health achievement, because if we look back at our track history, it's been around for 50 years. And if it wasn't for vaccines, we'd have terrible diseases that have practically been eradicated with the introduction of vaccines. So they've been around for a while, they've been tried, and they've been tested. Secondly, here in Canada, we do have a panel. Health Canada actually does the independent review. They do the approval, and they do the monitoring for releasing any drug or any vaccination into Canada. And they've been held in very, very high standards across the world. So just to lay people's fears to rest, Health Canada is very diligent and will not approve any type of drug or vaccinations unless it's independently reviewed and approved to enter onto the Canadian market. So far we've had 2 of those drugs. Sorry, my internet is unstable. Are you able to hear?
I can hear you
Can you
loud
hear
and
me?
clear. Yes. We can hear
Perfect.
you.
Yeah. So right now, we do have 2 approved vaccinations in Canada. So that's the one from Pfizer BioNTech. That's the mRNA 2 mRNA vaccines, and I know the panel will be able to also explain what what type of vaccine that is. And we also have the Moderna vaccine here in Canada. We do have a few other vaccines that are going to be introduced. They're pending approval here in Canada, and they work a little bit differently. But I wanted to focus a little bit closer on what these two approved vaccines do. So the mRNA, it doesn't necessarily mean that you're having a virus injected into your body, because this type of vaccine is made in the lab. So it's like a synthetic vaccine that simulates what the virus does. It's put into the body, and it teaches your body how to make a protein to fight against the virus. So when the real virus comes into your body is prepared to fight it. From that perspective alone, people's fears should be kind of alleviated, knowing that it's nothing extremely dangerous that's going to be put into your body. It's not going to change your DNA in any way. And what I really specifically wanted to get at was, if you're not sure about anything, including this vaccine, there's so much resources out there for you to go in yourself and to read up and to educate yourself and understand what these vaccines truly do, how they work, how they're going to benefit us, etc.
Mm-hmm. Dr. Chavi?
Thank you, Mala. Like, enough has been said already about the vaccines. It's just that the various vaccines that we are using are just in effect, so to speak, different ways of targeting the virus, so to speak. But what we need to always remember, and much like Dr. Chandra said, that this virus, and for that matter, all viruses are very intelligent. Their basic need is to be able to survive, much like we are trying to survive against their attack. They are always trying to get ahead of our game, so to speak. So they're very prone to undergoing mutations and coming up with strategies in order to counter the strategies that we have come up against them. These two vaccines, the Pfizer vaccine and the AstraZeneca vaccine, they are stored at different temperatures, and which is why a lot of it boils down to logistic issues as well, as to which organization is able to maintain minus 70 degrees Celsius, which is required for Pfizer vaccine, and which organizations are not able to do that. Some studies have shown that the AstraZeneca vaccine, which has only recently been approved in December, may not be offering as high protective rates as the Pfizer vaccine does. But then what we cannot forget is that we haven't had enough time to test these things out fully. But to answer your question that you had posed earlier, with anything that we try out in medicine, nothing is foolproof. And it is important to understand that even placebos work in 30 to 40% cases, and the best of medicines do not work in 100% of people. But much like it was being discussed earlier, that we also need to act out of our social responsibility. So it is not just to be able to save ourselves, but the act of going in for vaccination is to be able to ensure that there is herd immunity and we can collectively launch an attack against the virus. Having that, though, as far as protecting ourselves from having the virus go into severe debilitating states, it is important to understand that much like any other physical health problem, we cannot underestimate the importance of hydration and good nutrition and managing our stress levels and good sleep. All of those things, they do go a long way. There have been few preliminary studies which have come in to suggest that once these basic things are being looked after, the impact of the virus can actually be minimized on the body. So yeah, I did want to take this opportunity to emphasize that as well.
Thank you so much for that. The question that I wanted to ask you guys, all of you, is this. You have a patient who's tested positive. She's not severe, but will she still be able to get the vaccine while she's tested positive?
Well,
Okay.
So that's an yeah.
Go on.
No, after you, Dr. Bhasin. Go on, please.
Well, thank you, Dr. Chandra. The few absolute contraindications which are there, if there's somebody who's pregnant, in some vaccines, people under the age of 16, if somebody has had severe history of anaphylaxis or they're carrying EpiPens with them because they had history of anaphylaxis, these are some of the absolute contraindications. But as far as somebody having active infection whilst they're in the middle of it, I think, Dr. Chandra, you'll have to perhaps take this question. I don't think I'm the best person to answer this.
Yeah. So, well, we have a very good example. I know I don't want to get political, but let's bring in Trump for that matter. Yeah. So,
Okay.
So what happened with Trump, right? I'm going to answer your question, Mala. So Trump got the virus. He tested positive, right? But then he took the medication remdesivir, but he was also left alone without giving the vaccine because they wanted to wait to see if he'll develop natural antibodies, right?
Mhm.
So the natural antibodies, they take time to develop, but this is your natural strong fight against the virus. So which is much superior than the synthetic vaccine that is out there right now. So one thing the infectious diseases community suggests is, if you already tested positive, you need treatment, not prevention, right? You already have the disease. So to take different measures, because the vaccine can interfere with the immune response, right? So and also it's prudent to say it's case by case basis as
Okay.
well.
All right, I'm going to pause right now because I want to bring in Asha from South Africa, who's tested positive, and let's watch her video as she explains her symptoms, and then we can go back to this conversation.
To share my COVID experience. My name is Asha. I'm from South Africa, 49 years old. My comorbidities are I'm a diabetic and I have high blood pressure. On pressure medication, but for diabetes I control with the food. Last week, Monday, I've got very sick with symptoms like phlegmy cough, headache, lots of diarrhea and fatigue. And within a few hours, I was very sick. I had no energy to do anything. Loss of smell because I cooked and I didn't realize the stove was still on and the curry burnt. So I could not even smell that. And that was in the afternoon. I had a restless night. The next morning, I went to the lab and I got tested. Initially, I thought it was food poisoning or the flu. But when the loss of smell occurred, I realized it's something more. So I got tested and I managed the symptoms during the day. Whatever I experienced, took pain meds and having the effervescence. And by the afternoon, it was gone. Really hectic. Everything has gone worse. Had a restless night. The next day, I tried to manage the symptoms, but then the breathing issues started. And continued with the vitamin C, vitamin D sitting in the sun, having the zinc, steam inhaling with eucalyptus, having the Ayurvedic teas. Steam inhaling I did thrice a day, and resting. And by day 4, I had to visit a doctor because the breathing was gone very bad. So he did test for me and he prescribed me on a 3-day course of antibiotics. Once I started that, I felt a little relief, but the body pain started getting extreme and the fatigue. I added some flu medication with the other supplements, a nasal spray, an Astven pump, some melanin for flu to cope with the sinuses and all of that. And I continued in conjunction with all the other medication, steam inhaling and the Ayurvedic teas. By day 7, the medication was over. And day 8, I started, the doctor put me on steroids. And that helped me tremendously, especially with regards to the breathing, which is much better, much, much better. And I'm mobile now. I do get very tired, and the body pains are still extreme. The body pains, it feels like the pain of somebody experiencing shingles. The outer legs, outer thighs, upper arms, and the back. But as the days go by, today is day 12, I feel the pain have reduced, but not as immensely as I want to anticipate. So I'm just taking it as it comes. And with that, I do meditation. And so just managing everything as it comes. It's not an easy thing to go through. It's really sad. It's really traumatic. The death rate in South Africa is increasing. The rate it's spreading is increasing. I honestly think it's airborne now. It's really, really, really intense. Normally, the cemetery or crematorium in our area, in one area, we have a few deaths. Now it's 27, 30 people, bodies being cremated a day. So it's really sad, alarming, the loss of loved ones, the loss of complete families being wiped out. It's really, really sad. So my advice to each one of you is the symptoms vary. Everyone experiences different things. Don't take it for granted. Be safe. Get yourself tested. Even if you've been in contact with somebody around and you don't know, it's safest to go and test because you could be asymptomatic and passing it on to innocent people. As you can see, a little bit out of breath, but please do take care. Please be safe. Get tested. And Maladi and to your panel of doctors, thank you for listening to me, and go well.
So what do you guys say to that? Why was she on steroids to begin with?
So, Dr. Bhasin, you want to take that or?
Go ahead, Dr. Chandra. I'll speak after you. Yeah, thank you.
So, steroids, they're one of the main function of the steroids are it's anti-inflammatory. In other words, so let's say you have a fever, the body's natural response is trying to fight it, but sometimes it fights it so hard, it beats the body itself, right? So just to slow down that process, okay, to help the body fight the infection, we use steroids to reduce the inflammation that the body is trying to do. So that's the main reason. And steroids have been used like for most diseases, including, for example, asthma. Asthma is considered like an inflammatory disease. Mm-hmm. And then we give steroids, especially when you're like having an attack, you give steroids, which reduces the inflammation, because with inflammation comes the liquids accumulate in the lungs, in the heart. You start to have congestion, respiratory distress, right? It's not kept clean. So to reduce that overreaction, so to speak, the body needs to fight. Naturally, we're always fighting. The body's always fighting, but over fighting, then it becomes, a problem. So yeah.
Okay.
And is she still live? I'm sorry, or she's gone?
No. That was the recording because she wasn't well enough to come on live. Like I said, it's a 7-hour time difference between our countries. So it's like morning, early morning there, like after 1 o'clock, I think, in the morning right now.
Yeah, because I was curious because I don't know if I wanted to.
I really wanted her to come on live so that she can have this conversation with all of us. Seeing that we have 2 doctors on the panel and a nurse as well too. So it would have been beneficial, but she couldn't make it.
Right, but I do want to make a disclaimer. I'm not an infectious diseases doctor, just to make it clear. But however, I was curious to know if the worsening death rates in South Africa is because of the new South African strain, for that matter. Yeah.
I'm pretty sure she'll be watching this.
Just
Go ahead.
I just wanted to add a little side note to that question earlier about whether someone like Asha, who's had the virus already, whether she needs to get the vaccine. It's a common question that I get every day from people who are wondering, is it even necessary to get the vaccine? And according to some research that's been coming out, and it's available as well on the CDC website, the Center for Disease and Control, it's actually recommended to get the vaccine, even if you've had the virus, because having had the vaccine doesn't guarantee that you're immune already. So it is actually recommended to get the vaccine, and also it's recommended that from the CDC as well, that if you are currently sick with COVID-19, it's not recommended to actually get the vaccination until after you've overcome your illness, and you've met a certain criteria to get the vaccine. So you'd have to be asymptomatic for a certain period of time, and a few other things will have to be met before you could be considered to get the vaccination.
Okay. We do know that the ICU is loaded with patients who are on ventilators. And I know that a lot of our viewers, and especially a lot of the younger people, they don't know the dangers of being intubated. And so what I would like is if both of our doctors, or even you, Sunanda, as well, if you know anything at all about the process a patient goes through when on a ventilator and some of the after effects of intubation, if you can share that with us, that would be great.
I guess I'll let the doctors go, because I have not had firsthand experience of watching a patient. I've just had received patients who've already been intubated. So I haven't actually cared for anyone at the point of when they're being intubated. But from the stories that I've heard from my colleagues, it doesn't look as if it's a pleasant experience. For one, I know that mostly the patient would be more or less unconscious for that process to happen. But the fact in itself of having to be put on a ventilator, it's pretty serious. And it means that that individual is not able to breathe properly for themselves, and so they require a machine to kind of artificially help them with that process. So I can imagine that it's a very high risk and very dangerous procedure for that patient.
I remember watching a video on it, I think a couple months back, and the thought that was going through my head was that, if somebody that I know, one of my loved ones, say for instance my mom, or somebody that I love and care for, was in that position, they're alone, you're not able to be there with them, and that process of intubation looked really, really scary.
Yeah.
So Dr. Vijay Chandra?
Yeah, so now again, underneath all this I would consider what we call in psychiatry as a traumatic experience, right? So the process of going into ventilation, it's not a preparation, right? You can't prepare for that. Okay, things just happen. You're falling sick, and then you go into that process of being ventilated. Both before and after the process, I'm sure you go through mental agony and anxiety, and even it can be a pretty traumatizing experience, because you don't know if you will survive the process, let alone the pain, right? So this is where mental health becomes even more important. Of course, we have shortage of psychiatrists, psychologists, and bedside caseworkers, but in these times of like increased life-threatening procedures such as ventilation, so following up the patients after they get discharged, a smoother transition, so to speak, psychiatrically back to their community, back to their loved ones, and really screening for new onset anxiety, new onset PTSD for that matter, right? New onset depression. You could remain anxious that you might get another fatal disease for years to come. Okay, and I don't know. I don't know how many in the panel have had a nasal swab for COVID, right? I did not do well.
I haven't.
Yeah,
I haven't.
yeah, just a small nasal swab going into your nose was so uncomfortable, right? I literally had to cheat myself to get my friend to do it, because I work in the hospital. I'm assume I'm going to be the positive or immune, okay, all these months and years. So what I'm saying is that in itself was such a nauseating experience. Imagine a ventilation, no matter how much they're anesthetized. So, but you brought up a good point, which is mental health. This translates to trauma. It's not just the physical pain of going through the ventilation, but imagine the psychological effect it has for years to come on this person.
Yeah.
Mm-hmm.
Dr. Chavi, any thoughts on that?
Thank you, Mala. I would agree with what Sunanda and Dr. Chandra have said. And just to add to that, well, there have few studies which have gone on to say that if somebody has gone on to a stage because of COVID where they're having to be ventilated, there are high chances that they may have long-term impairment in their lung function for the rest of their lives. So that is something that we need to be aware of. So when you said that, are there any after effects that we'll be talking about that could deter people from, so to say, getting out like they are and flouting rules, is the fact that there's enough evidence to suggest that if somebody has gone on to a stage where they're having to be on a ventilator, there's a good chance that they will have some sort of, not all of them, but quite a lot of them could have some permanent lung damage, which doesn't sound and in some people permanent damage to their senses of taste and smell as well, which may never come back at all. So I think these are very scary parts of having human experience, have these senses, isn't it? So it seems so it seems very trivial, but I've actually seen two patients in my career as a doctor where they have lost their sense of smell because of some antibiotics which were used, which had nothing to do with COVID. And when you do have detailed chats with these people, to lose your sense of smell and taste, I can't even begin to use words to emphasize how paralyzing a feeling that can be. So what I would really want to emphasize here is that if situations do come to that where people are having to be on ventilator, then perhaps COVID has caused a lot of damage that they may have to live with a lot of permanent disabilities in their physical health.
So overall, everyone should take heed and make sure that they are social distancing, wearing your mask, sanitizing, washing your hands, and staying home, right?
Absolutely.
Oh my goodness.
Right. Absolutely. Mal, I do want to address one more thing before we move off of this topic. So as per Ash's experience in South Africa, they may have used a steroid to treat. But I just wanted to add here that at this stage in the game, we're not 100% sure about what treats COVID-19. There's lots of drugs out there that are still under review. They have, there's not any one drug that so far is fingered to be the drug that will be used to treat this disease. For example, here in Canada, there are a couple of antivirals that are currently being reviewed as potential treatments for COVID-19. So, there's different countries may adopt different approaches, different models, but just to clear up that misconception, we don't yet have a specific drug that is tailored specifically to treat COVID-19.
Okay.
So I'll move on to the next topic that we had tabled for discussion, and that's in regards to depression. We know COVID has definitely accelerated the rate of depression, and I'll get the panel to talk about this. We know that the lockdown has and will continue to cause severe depression for some people as we continue to face severe restrictions with social distancing, travel restrictions, and just the mere fact of not being able to say goodbye to loved ones that are dying in the hospital alone. Can you comment on the current mental well-being of the population at hand that you've come across as doctors and nurses?
So, interestingly, one pattern that I've seen in last 1 year, ever since we've been living in this COVID world, is that um, some people who have had mental health problems for last few years have actually done surprisingly very well during COVID times. And these are people who've always struggled with agoraphobia, who've always struggled to get out and socialize and fulfill the expectations that the society and the world has from them. So interestingly, I was having this conversation with a colleague of mine, and we were thinking that perhaps COVID has been able to neatly divide the people with mental health problems into two groups. One who has done exceptionally well during lockdown, and they seem to actually welcome lockdown. And perhaps part of it is to do with the fact that it brings in a sense of relief that the world can finally see what it is like to live with the problems that they have always lived with. And that has also brought in validation in their lives, because a lot of the family members and friends and relatives who didn't understand what their struggles were about have now come back to them and said to them, well, we get it now. So interestingly, there's that. um, the other group, of course, where we are humans, we are social animals, we all need to have company, we all need to get out together with each other, we all need touches. And so the second group that we have all seen emerging up is that the inability to be able to do that with our loved ones has actually skyrocketed the incidence of anxiety, has increased the incidence of depression, has increased the suicidal thoughts a lot. So really both the groups are there. um yeah, which is why I said in the beginning that it is understandable that humans are now in a phase where they just can't take it anymore and they just want to get out. A consultant psychiatrist I have worked with for last 2 years, and she's a very senior doctor herself. She has a lung condition, and which is why she hasn't been able to even work from office, so she's having to work from home. So she lives with her own child, and she said that even she can't take it anymore, despite all the training and understanding that she has because of her profession. She's like, she's had enough of it getting to her now, because the only socialization that she could have had in the capacity of her being a professional could have been at the workplace. But for last 1 year, she hasn't seen the site of her office either, or her colleagues. All she sees are people on the screen. So it is not something that we can dismiss entirely. While it's important for us to stay cautious, while it's important for us to understand that social distancing is one of the most important factors in flattening the curve, but at the same time, we might very well be sitting in a stage where we will be seeing skyrocketing of mental health problems. And this really cannot be ignored, so to speak.
Awesome.
I mean, calls and virtual calls are not quite the same as face-to-face contact is.
Absolutely.
Dr. Chandran?
Yeah, I mean, I think in my personal experience in the last 1 year post and current COVID situations, I've seen more anxiety and panic disorders worsening compared to being depressed. These are patients who are already like at an anxious personality. Now they have another reason, because this is what anxiety is. Anxiety is tendency to worry about general things, over worrying about general things. Anything could be a trigger, right? The thing about anxiety compared to depression, it doesn't let you sleep. Anxiety doesn't let you sleep. And you then go into insomnia, and insomnia affects your immunity.
Yeah.
Okay. So sleep is so important to have because that's when you know, I'm going there.
I need more sleep. I can attest to that, because I'm suffering big time, lack of sleep.
Yes. And there is, okay, exactly. So sleep is a different entity, but being anxious about something else affects your sleep. And with our sleep being affected, your immunity is affected, you have a more chance of getting the virus. So this triad, right? So that's why I think I've mentioned this before too. Mental health, whether it is anxiety, depression, or sleep, the most important thing is the internal things that we can do. Like I've always mentioned about being able to exercise, right? Because if you exercise, whatever exercise works for you, whether you have a mental health or you don't have a mental health, This is according to even a Harvard study. We all know very well, like, eating, sleeping good, eating good, and exercising is like the cornerstone for like spiritual well-being, mental well-being, right? But also for immunity. So that's where I again tell you, people who are refusing vaccine, people who are worrying about all these things, be scientific. This is the time to be scientific about you, to learn about your own mind and body, how the body works. So if you become more aware of it, if you develop more insight into how things are operating, the depression wouldn't get worsened, the anxiety wouldn't get worsened. You will be enlightened to know that this is what it is.
Yeah, very good, very true. And I'm lacking in exercising and sleeping.
That's a different program, Mala. That's a different topic.
we need another panel. Yes, I mean, I
need another couple hours for that.
Yeah, that's right. That's right.
So we also know that those that have experienced COVID-19 and their extended family, it is a traumatic experience. Do you think that we will see a lot more cases of post-traumatic stress disorder, or as we know it, PTSD, as a result of COVID-19? And also, have you seen the rate of depression increase with the frontline workers during this pandemic?
That's a really good question, Armala. I do believe that we will be having an increase in PTSD, more so for the population of people who are grieving, who've maybe lost someone along the way to COVID-19, and who were not able, they were not given the privilege of properly saying goodbye and maybe gaining closure and completely processing the experience of losing someone that they've loved. And I do believe that this will come back to really haunt a lot of people after we're over this. So to answer that question, yes, I do believe that there will be an increase in the prevalence of PTSD because of COVID-19. Now, in terms of the increase in rates of depression, in my experience, I believe that if you enter in the process in a career of being a healthcare worker, you come in with a sort of resilience. There's along the way, you kind of gain the experience and the knowledge of how to kind of process bad experiences, and you take on the responsibility of holding other people's hand throughout the journey. And a lot of the times we put our feelings behind. And recently I did have one experience where I thought I would have lost a patient one night, and for some reason it just hit me that this guy was really sick, and he wasn't going to be able to see his family. He wasn't going to be able to say goodbye to the people that he loved. And that night, I believe I felt it the most because it brought tears to my eyes. And as I mentioned before, I'm very resilient, and it kind of forced me to really sit back and consider the effect of this whole experience on my psyche as a caregiver. And I realized that yes, there's times when we don't do so well, and we do internalize it, and a lot of the times we ignore it, and then it shows up and it manifests in different ways in different sections in our lives. And I feel that having had that experience, thankfully, I was able to really confront my own self, my own emotions, and realize that I do have to find a way to cope or to offload in a healthy way. So yes, I've seen that with myself and with other co-workers as well throughout this whole pandemic situation.
Mm-hmm. Thank you, Suganya. How about Dr. Vijay or Dr. Chavi?
Thank you, Urmila. Well, yes, in times to come, we may see an increase in the prevalence of post-traumatic stress disorder. As far as depression is concerned, I I can't quite comment on whether the rates have gone up, but I could surely say that the chances of people acting on their suicidal thoughts has certainly gone up. So in cases where people have already been depressed, their chances of acting on those suicidal thoughts has certainly gone up. And the reason for that is that even though help's available, even though virtual contact is happening with the doctors, for example, most of our appointments these days, especially during the lockdown situation, in order to cut down the infection rates, we are seeing patients virtually. Even though that contact is there, but the fact that you're not being able to see your friends, the fact that you're not being able to see your family, the fact that we are not being able to touch and hug and really see people face to face goes a long way in increasing the chances of people feeling really isolated and people feeling really stuck in a circumstance. And which is why, if it was perhaps to be thoroughly investigated and studied, we would find out that the chances of people wanting to end their lives and actually, unfortunately, ending up acting on those thoughts is certainly going up. That's not something that I found in articles per se. That does seem to be the case. Having said that, though, it is important that I also kind of emphasize the positives. And I think equally in the patients as well as in my colleagues and friends and family, and in general, the vibe that I have, that on one side we have the media spreading all these things, which sometimes can become a bit too toxic and negative. It's important to talk about information. But on the other hand, I see there is this whole gratitude wave as well. Gratitude practice has really gone up and people are far more thankful these days. There are a lot more out there to help people in their community. They're being able to appreciate the tiny things which went unnoticed. So whilst, yes, the chances of mental health problems are going to go up, I do want to focus on the positive, because it is positive enough and measurable enough to see that perhaps in the world to come, we as a community and we as a species are perhaps going to learn to be far more thankful and be able to appreciate things that we have. So who is to know, things might get spun in the positive direction as well, that mental health problems might start going down. And I would not want to sort of lose sight of that optimistic spin.
Absolutely.
Awesome, indeed. Thank you. Next question, Irmela.
Sorry about that.
Sorry about that. Also, I got disconnected for a brief moment.
I thought we lost you there for a minute. I thought you got bored of this conversation. I
I
mean, it is.
Was there
We
anything?
are talking about depression, but it's also depressing when you think about the numbers and you think about how depressed some people really are. Not being able to go out. I just got a flash on my screen about 11 in Quebec. There's a curfew going on at 8 o'clock, from 8 p.m. until 5 a.m. And a lot of people have taken to the streets in protest of this curfew. I mean, it's ridiculous. We're talking about people's health here. There's a curfew in place for a reason. And, that's just one of the things that we have to deal with. The people are just tired of this COVID-19. They want it to disappear. They want to go back to their normal lives. And it's unfortunate that we are in this situation, but we have to deal with it as best as we can. And, take it one day at a time. That's all I can basically say. Sorry, go ahead.
I was just going to ask if I can share a personal experience of my child that's actually having a really tough time, coping with being away from her friends. So, as a nurse, sometimes I tend to overlook things and I try to, maybe look on the brighter side and believe that everything's okay, until a few weeks ago when I got a message from my daughter's teacher telling me that, my daughter may be suffering with depression, and she's 10 years old. So that blew me away, and it really made me, look really closely at what the effects that this pandemic is having, not only on adults but on our children. And when I tried to obviously find out more on what was happening with her, I realized that she was really missing the interaction, the social and the interactions with her peers, and it was really taking a toll on her mental health. So with that, I would like to encourage our parents as well. Kids, usually it's really hard to tell when, Dr. Chavi would be much better off explaining more about this, but I think sometimes children, it's really hard to pick up certain certain key indicators that they may not be doing so well. So I'd like to implore our adults and our parents to pay special attention as well to that population who do go through these challenges as well.
Mm-hmm. Yeah, exactly. These are trying times for everybody, and we cannot dismiss the children because they are so used to going out and playing and having play dates with their buddies, and right now they have to conform to learning online. And I know, Armala, you have a daughter who's...
Yeah, actually, I was going to jump in and just echo Sunanda's, sentiments of depression with young children. I myself have a young teenage daughter, and this whole learning experience, the e-learning, has taken its toll on her as well. And just the way, as you say, we're creatures that require some social contact, and she is having a hard time right now with not being able to see her friends in school and adapting to learning online and not having that one-on-one where if you have an issue you could go to your teacher and talk to them. So it has taken its toll on her, and we have to be aware as parents that this is affecting the young children as well. And one thing I wanted to touch with on the panel is, what are some of the symptoms of depression and what steps can we take to address this? And, where can we go to get some mental health support? Like, if the doctors want to jump in, and even Sunanda, if you have any resources you can share with us, that'd be greatly appreciated.
Okay, so I'm definitely not an expert in this area, but I can give you some general tips. So, I mean, it varies from one person to the next when it comes to signs and symptoms of depression. It could look or manifest in a physiological way, maybe weight loss, maybe you might become very withdrawn, socially isolated. You might lose interest in things that you once enjoyed. So it varies depending on different individuals. And in terms of resources, I know that the first thing that as a nurse that we try to encourage people who start developing signs and symptoms of depression is always to talk about it, somehow or the other. It's not always easy for a person who's going through depression to even admit it first to themselves that they're going through depression. But if they have somehow managed to reach that point of really accepting that they are suffering from depression, then the first step is to actually find some way of letting it out. Of understanding that there's always hope. No matter how bad the situation may appear, that there is always going to be something that will happen, that will make it better. And it's just a matter of time. So, those are the basic tips that I would like to share when talking to my patients or even with myself, that it's bad. Nothing is ever going to be perfect, but if we hang in there and if we do try to stay positive, we'll be able to overcome. Of course, there may be situations where it might be a little bit more severe, more complicated, and there's so many different types of resources that are available from government level or provincial level, etc. And I'd like to encourage anyone to make use of it. It's free. Most of them, they're 24/7. And one of the biggest one that I'd like to share with your listeners tonight, Mala, is Connex Ontario. It's a really, really valuable resource. It's available online. Just type in Connex Ontario, and you'll be able to pick up a list of various mental health resources that are available out there at your disposal, free of charge, 24/7.
Thank you very much, Sunanda. That was very helpful. Dr. Chandran, you're the expert here.
Well, as always, I think Dr. Bhasin too. So I don't know. I have to quote this. So we have a Bible for psychiatry, for mental health. It's called DSM-5, which is like Diagnostic and Statistical Manual. So they have they have a more scientific definition of depression, because people think of depression like, you talk to somebody, they had a breakup or what, now I'm depressed. Okay, that doesn't qualify as for a depression per se. And there are many types of depression, but I just want to say that there are you need to have 5 symptoms for 2 weeks. That's like the scientific definition. Just to add to what Sunanda was saying, one of the things, two of the main things that needs to be there is you feel like you ask somebody, how's your mood? And they feel like my mood is low, or my mood is depressed, And then one of the very important thing to qualify as a depression is that they don't enjoy the things that they used to enjoy before. Basically, lack of pleasure, right? So those are 2 very important symptoms. Besides, of course, you're having sleep issues, you cannot concentrate, you're withdrawn, your negative outlook on life, and you can even be suicidal, right? And they're not eating well, appetite loss. So those are some of the things, but they need to be present for 2 weeks. If somebody has it for these symptoms most of the day for 2 weeks, then you can diagnose them with depression. But again, here's the other biggest caveat. Medication is not the first line treatment for depression, right? You start with therapy. And in this day and age of apps, there are multiple apps out there just for some, technology-based psychotherapy. But again, if somebody is really depressed, you need somebody, an helping hand to get them to the treatment, right? So if therapy fails, then the medications are recommended. And I just want to put it to the audience. We have some of the best medications for depression. These are really benign medication. They're not so dangerous to the body, and the benefit outweighs the risk. Because remember, depression, like asthma, diabetes, is very damaging to the brain. Okay, it's very, very damaging. It creates imbalance. The chemical imbalance in your body triggered by an event such as, let's say, COVID. You got COVID or some other psychosocial thing happened in your life, and the body's chemistry changes, then you go into depression. So, and that's what the medication does. It resets the normal biochemical process. But if you don't do it, especially the first time you get depressed, the body's still fighting it. It has long-lasting effect on the brain. So it's better to treat depression than to wait, because this is what we back home in India, we think, right? Oh, it's okay, you're just depressed. We don't take it seriously. Okay. And it's a stigma too, to be depressed. Nobody wants to, yeah. But now we are doing better in mental health. Like you see somebody right away, they're depressed, we take steps. So the stigma is getting better. So that's what I would say.
Awesome. Thank you guys so much for that. I think we've lost Dr. Chabi. She's no longer in the group. Maybe she had an emergency. But that's okay. We have one last question for the panel, and then we'll let you go. I promise, it's getting late. We've been on here for a very long time already. In your opinion, after this pandemic comes to a close, however long that may be, what steps do you think as a global community we should take to better prepare ourselves for the next pandemic? And what would life look like after COVID-19? Who wants to go first?
I guess I'll let VJ go first.
I mean, if you're wanting us to comment at the global level, right?
Yes,
so
I would say global level.
Yeah, okay. So at the global level, we will be still living in fear for years to come. This is going to be a defensive approach globally, number one. And also globally, there is a change in how we interact. In other words, the remote working is becoming more and more common.
Yeah.
Right. So with remote working comes, it has its own benefits and risk, as you know. Then comes to recover globally from this financial disaster.
Yes.
Okay. So yeah, and then also being able to have less resources for the next 3-4 years globally to recover from this is going to take some time.
Mhm.
Absolutely.
Yeah. So that's where I keep saying this. We cannot prepare just for the next 3-4 years because we don't know what's coming, and that's what life is about. But
Yeah.
one thing globally we can do is individually we need to be more healthier, physically, mentally, and spiritually, because that's the only way we can live a successful life. You could get corona. Corona is not the end of the world, right? But how resilient you are mentally, how can you prepare individually? Because we have lost, in all this process, we lost the concept of how can we be well. I don't see people still
Right.
thinking and working towards exercising, eating well. No, I've seen people smoking. They say smoking is the number one reason for reducing your immunity, right? You stress, you're anxious, what do? You smoke more because the amount of smoking and alcohol consumption has increased, right? So these small things, that's how globally we will prepare for the next pandemic.
Okay. Sunanda?
Hmm. I know you're probably out of time, Mala, but if I'm to comment on the SARS that occurred a couple years ago, what I know here in Canada from the SARS is that it informed us. It helped us to become better prepared for the next pandemic, which we're in right now. So my thoughts are that the world will continue evolving, will continue learning, will continue building on what we know before, and I see it as a process that's going to be dynamic, ever changing. It's gonna keep going and going and going, and hopefully, ideally, every time we're going to get a little bit better. Nobody can predict that we'll never go through another pandemic again. The last pandemic that happened, we thought it would have been the last one, but here we are again. So
Yes.
I think that to kind of say that this will inform us on how we'll never have a pandemic again will be very naive. The possibilities do always exist, but we have to keep learning from what we know already and improving every step of the way. And I see that we are doing that. I mean, especially here, I can only comment on what's happening here in Canada. I know that this time around, what we learned from SARS, we took that knowledge and we helped to improve our response at a hospital level, at a country level, and the ripple effect goes on. Now, you asked the last question of what I would like to see or what I've learned myself, or what the world will look like in a couple of
Yes.
years after this pandemic. And I can only comment on that from a personal level. I will definitely cherish every single moment, especially the moments that I spent with my family. The people that I love, and the things that I love to do, traveling and so on. I don't think I'll ever look at it again in a light way, and I'll ever take it for granted. So it definitely helped to, I guess, to motivate me to understand that life is so fragile, it's so vulnerable, and every single moment, every single second is so important, so vital, and so
Exactly.
special. So that's what I will take
Absolutely.
away from this.
Absolutely. Thank you so much. Armala, any closing thoughts?
Just from my perspective, I think we have to be open-minded and be adaptable to change. And I think once, and this is from a global level, like we've seen across the globe how because of COVID, businesses and the way we do business, the way we work, we've had to be adaptable to change. And, there's always a different way we can do things, and just be open-minded. And as Sunanda said, like, cherish the time that we have as well with our family members, and even globally within our communities globally.
Mm-hmm.
Be a little bit more aware and cognizant of the fact that we're not here just for ourselves. We're part of a community, and just
Mm-hmm.
seeing what within our local community, how they've stepped up and they've helped each other. You help your
Mm-hmm.
neighbors, you've been helping your family members cope with issues, like simple things like, if someone is homebound and they can't go out, and just doing things like ordering them groceries and dinners and being able to help them out in that way where they can't do it for themselves. You know, be cognizant of the fact that we're not just here for ourselves, we're here as a global community.
Mhm.
And we need to do whatever we can as a global community
Mhm.
to, again, flatten the curve and help the stop of this, and you know, and preparing us for whatever may come in the future. Be adaptable, and I think that's my little take on what I've learned so far.
So as we close right now, do you guys have any parting words for our audience right now?
We just have to keep doing this. I mean, it's frustrating as we've seen, but we do have to keep going. There will, there will be an end. Nobody knows when, but we have to still be resilient, strong, and focused on the end goal here, I think.
Dr. Chandran?
Yeah, I mean, it's been a tough ride. And what I encourage again is to be open-minded. I want to again reassure all of my friends who are all doctors and nurses. Almost 99% took the vaccine. I really, really recommend. We have to believe in the science, and we have to believe in our scientists. This is not about a propagation to make money. We have, there is something called the world ethics. So nobody's trying to make money out of this whole thing that we are in together. So right now, at least for the immediate future, one thing we all could do is wear the mask, focus on being more and more healthy, building your immunity, and at the earliest possibility, really take the vaccine. And please, if you're smoking is going to the lungs directly. It affects your immunity. And no matter what you do, you could take the vaccine and still be smoking. It is not good at this time right now. Okay. I believe it has about 6,000, 7,000 carcinogens. It's just and like I was saying, Harvard puts not smoking as the first recommendation to improve your immunity. So if you're against vaccination, so be it. If you're against wearing masks, so be it. But please give up on smoking.
Well, thank you very much, Dr. Chandran, for all of your information, your informed point of views, and also to Sunanda G. Thank you so much for being here again, both of you.
Thank you, Mala. Thank you, Armala.
Yeah.
Thank
And
you, Vijay.
It's
a pleasure being here with you again.
I just want to be able to thank Dr. Chavi as well too, but she's no longer on the panel. She's left. So Dr. Chavi, if you're watching this again, thank you so much for being on the program for the very first time. And we truly appreciate your point of views as well too. And also to Aruna Jagdeo and to Asha from South Africa. I hope you feel better soon. And I just want to say thank you again, everyone, for being on. Armala, thank you so much for being my co-host. And I personally want to thank each of you for taking the time out of your day today to be here so that you can share some of this very, very important information to our audience who's watching. I'm pretty sure a lot of people will be watching it after. I also want to say that I look forward to speaking to each of you again, possibly maybe in another 6 months. Let's see where we're at.
Hopefully on a different note, maybe on a lighter note, perhaps.
On a different topic. Oh my God, yes.
On a different topic, yeah, for sure.
I think that would be weight loss and sleep, right?
Weight loss and sleep, yes, for sure. Dr. Chandran, get ready.
Yeah.
Oh my goodness. On a lighter note, thank you again, guys. I truly, truly appreciate it. And I just want to say a big thank you to all the doctors, nurses, hospital staff, emergency staff, all frontline workers, business owners who have kept the stores open so that we can have food and medicine available. I say from the bottom of my heart, a humble thank you to each one of you for being there doing what you do on a daily basis, putting your lives at risk for us. So thank you so much. And to all of our viewers who have been locked on, just want to say thank you so much, everyone, for watching. And please, please, please keep wearing your mask. Continue to social distance. And it's imperative for all of us to have patience with the system and do our best to keep ourselves and our loved ones safe. And also, as you carry on your week, do remember to always be kind and stay positive, and have yourselves a wonderful week ahead. And I will leave you with a song. It's titled, We All Need Someone to Lean On. And yes, we do all need somebody to lean on. So thank you very much, everyone. Good night. And hope you guys have a wonderful, wonderful week ahead of you.
You too. Bye-bye. Thank you.
Everyone.
Bye.
Bye.
Bye, everybody.
Bye.
Bye.
Awesome indeed. Thank you so much, everyone, for joining with us. And we will see you again next week, same time, same place, as we continue on our entertainment segment next week. So I hope that this segment was informative, and you will take this video and share it to your friends and family, those who have missed it, because it's filled with a lot of information that I think a lot of you can gain from. And, you know, it's really, really important that we keep safe and we keep practicing social distancing, wearing the mask, sanitizing, and just stay home. Everybody, please stay home. Let's flatten this curve. On that note, have yourselves a wonderful week ahead. Good night and be safe. Thank you.